Good morning, distinguished members of the press. The NCDC continues to closely monitor the ongoing outbreak of the Bujumbura Ebola virus disease in the Democratic Republic of Congo and Uganda. Let me begin again by reassuring Nigerians that as at now, there is currently no confirmed case of Ebola virus in this country. We don't hope to have. However, following the ongoing transmission in the region, the NCDC has conducted a comprehensive dynamic risk assessment, which classified the risk of Ebola importation in Nigeria as high. These assessments reflects some of the factors concerning, that got to this reflects regional transmission. We can discuss this after, during this international travel and population movement, our porous borders, and the potential for delayed recognition because Ebola symptoms and signs may resemble those of malaria and other fever conditions and Lassa fever. The seriousness of the current outbreak is reflected in the declaration of a public health emergency of international concern, that's fake, by the World Health Organization on May 17th, and a public health emergency of continental security by Africa CDC on May 18th. While there are currently no widely available licensed vaccines and approved targeted treatments, specifically for this strain of virus, experience from previous outbreaks has demonstrated that early detection, rapid isolation, infection prevention and control, contact tracing, risk communication, and effective emergency coordination remain the most effective tools for preventing transmission and saving lives. What have been our preparedness system up to date? Since confirmation of the outbreak in the region, NCDC has intensified preparedness and activities nationwide to ensure that Nigeria remains ready to rapidly detect, investigate, contain, and respond to any potential importation of the disease. Some of the things we've done so far are, like I said, a completion of a national dynamic risk assessment and vulnerability analysis to guide preparedness planning and prioritization of interventions. The assessment of risk and vulnerability analysis shows us the areas of gaps that we need to fill and what to do. We have activated the enhanced national preparedness coordination mechanisms and placement of the National Emergency Operations Center in Abuja on the alert mode to strengthen our readiness, coordination, information sharing, and response planning. We have also completed the WHO Ebola, they call filovirus, that's the class of Ebola, disease readiness assessment and deployment of preparedness assessment tools to all states to support systematic monitoring of readiness capacity and gaps. We have completed a national risk stratification exercise, categorizing states according to their likelihood of Ebola importation based on international points of entry, population mobility patterns, and border connectivity. This risk-based approach is guiding preparedness activities across the country. We have developed nationwide dissemination of Ebola case definitions, mostly to case managers like doctors, nurses, and people in surveillance areas. Also, case definitions, surveillance protocols, contact tracing procedures, and self-quarantine guidance, and traveler monitoring protocols to strengthen early detection and rapid response. If I may explain that, there's case definition for Ebola. You cannot say somebody has Ebola if the person does not conform to specific criteria for case definition. Many people can present with fever, etc. But one of the things, or bleeding, it could be Lassa fever or this. But one of the things again is that person must have actually been to that area where Ebola has been detected. That is, in the last 0 to 21 days. You understand me? If there is no travel history, the chances that for with Ebola to be Ebola is not there, except of course you have internal whatever it is. And surveillance protocols. Protocols are guidelines we give to surveillance officers to check when they go out again to collect data and all for all these. So some of these protocols we've given out, disseminated. We've established enhanced surveillance and public health monitoring measures for travelers arriving from affected countries. What I'm saying is that if you recollect, I think last week or 2 weeks ago, the Minister for Health sent an entry protocol for people coming in. And this protocol again, similar to that, have been have been copied, amended by the different aviation agencies. Like I think NCDC have to issue this out to airlines coming from those affected countries of what and what to do with people coming in. Those are guidelines are very essential for this. So we've done that. We have the seven national public health advisories, health worker guidance to all states. We've released advice to health workers. We've released advices to states. We've released advices to the general public who will continue to do that. We've done the readiness assessment of about 549 health facilities across 32 states just to see how ready they are. And where they are not ready, we have to draw their attention to what and what they need to do. That's why it's called preparedness. Well, let's prepare for this kind of thing. Including the Federal Capital Territory. And we've assessed about 17 designated treatment centers, just in case this citizen, to evaluate screening capacity, isolation readiness, IPC control systems, healthcare worker protection and treatment readiness. We have developed and disseminated Ebola awareness messages, frequently asked questions, myth versus fact information products, and other public communication materials to support public awareness. Some of these, most of these are on our website. We are strengthening collaboration with state governments, National Orientation Agency, and healthcare institution and development partners and other stakeholders to ensure a coordinated preparedness effort. In fact, as a matter of fact, I think 2 nights ago we had a virtual meeting with all state commissioners of health, and they held that in Lagos here. After we had sent them about a week before, we sent them various letters to tell them what to get ready, and they were supposed to give us a feedback on how far they've gone, what their challenges are. And we now held a meeting with them again to get their feedback. This was 2 nights ago. So we are doing an assessment of the national emergency stockpiles and logistics capacity. In this kind of thing, we don't wait for things to happen. We have stockpiles of materials. And don't forget again that apart from Ebola, we've been managing about 8 outbreaks in this country, which we continue to manage. Lassa fever. I'm sure in one of these papers they talk about cholera in Borno State or something, right? You have mpox, you have all those things still ongoing. And it's the same infrastructure for this that we use. It's just that this is changed depending on the disease we're talking about. So that is there. These actions have significantly strengthened Nigeria's capacity for early detection, rapid response, laboratory diagnosis, IPC, infection prevention and control, health worker protection, risk communication, emergency coordination, while efforts continue to address identified gaps and further enhance national readiness. These are preparedness efforts. Where we see gaps, we try to address those gaps. One of the things I give you again is at the point of entry. Our plan, maybe during your questions and answers, let me just say. Preparedness is a shared responsibility. It's not only federal government. Everybody needs to be involved, including the states. Because some of these diseases can even start from within the states themselves, one villages. So, while NCD is leading national coordination efforts, effective prevention and early response require active collaboration among state governments, healthcare facilities, communities, development partners, professional associations, and the public. The actions being taken today are designed to ensure that Nigeria can rapidly detect, investigate, and contain any suspected case before wider transmission. What are our next steps? We're working closely with state governments and partners to identify more gaps and strengthen preparedness capacity. So the states have been requested to activate and sustain preparedness coordination mechanisms, just like I do in NCDC. Each state is supposed to do that on their own. They should strengthen their surveillance and alert management systems, operationalize designated treatment centers, intensify preparedness activities at points of entry and transport hubs. Now we say points of entry. We have 5 international airports in Nigeria now: Lagos, Abuja, Kano, Enugu, and Port Harcourt. Those are key areas. And what we've done is that, apart from discussing the port health services there and the immigration and all the other aviations, those people need to link up with the state governments so that they can work together, just like they are doing in Lagos now. And Lagos State and the port health services and the aviation thing in Lagos here, they've been at the scene for quite a while. So we want all those states, international airports, to do the same. They say intensify preparedness activity at points of entry, strengthen infection prevention and control measures. We cannot stop saying this. IPC is the major source of control for this kind of thing, not only for Ebola, for many of our disease outbreaks. Infection prevention and control. We discussed that during the question and answer. The state government should also support healthcare worker readiness. Why this is important? Healthcare workers are important. They are the people who manage these cases. And before they even manage again, they have to protect themselves. So that's a part of readiness. What form of protection would they give? PPEs and all those things they need to provide for them. Maintain routine preparedness reporting to subnational action. So our message to healthcare workers: while they remain our first line of defense, we urge all clinicians and frontline healthcare workers to maintain a high index of suspicion, particularly amongst persons with recent travel history to affected countries or epidemiological links to confirmed or suspected cases. In other words, they have to carefully assess the travel history, exposure history, contact with sick persons, and attendance at burial or funeral activities where relevant, and promptly notify public health authorities when a suspected case is identified. They should also continue to always implement their standard IPC precautions. To the members of the public, we encourage Nigerians to remain calm. I say again, we do not have any case of Ebola in this country. They should remain calm and continue their normal activities. However, they should also obtain information only from credible sources. Avoid spreading rumors and misinformation. Practice good hygiene, the same thing IPC, hand washing, proper sanitation. These are key. And promptly report any unusual illnesses through established public health channels. In conclusion, Nigeria successfully contained the Ebola in 2014 through strong leadership, rapid detection, effective coordination, public trust, and collective action. Today, we are building on those lessons and strengthening preparedness even further. Thank you.